Hello everyone, my name is Harleen Jhinger, and today I will be presenting the research I did last summer with the Royal College of Surgeons in Ireland University of Medicine and Health Sciences Research Summer School. I completed a meta-analysis on mentorship in healthcare under the supervision of Miss Bridget Murray and Miss Comfort Chima. So a variety of techniques are used to ensure that the constantly changing expected competencies of healthcare professionals are thoroughly met. One such technique includes mentorship, also known as preceptorship, where an expert works as a mentor to guide a less experienced individual, who is known as the mentee, in the related subject area. Our aim for this project was to provide an overview of mentorship relationships found within the healthcare field, and to determine specific characteristics that may be considered when pairing a mentor and a mentee through a review of the literature. Specifically, our research question was to see what the impact of mentorship is on advancing professional healthcare in terms of clinical competency skills. So during our search of the databases, the population we were considering was healthcare professionals, including current students in healthcare fields. We considered randomized controlled trials with a mentorship intervention, compared to a control group that did not receive mentorship. The outcome we compared is the clinical competency levels. So we decided to search 4 databases, which were CINAHL, Cochrane Library, Embase, and PubMed. CINAHL generated 103 results, Cochrane Library had 50, Embase generated 83 results, and PubMed generated 289 results upon entrance of our keywords, which we will take a look at later. These results were then placed against our inclusion and exclusion criteria, upon which remaining articles were scrutinized through quality appraisal. Quality appraisal involved an EBL and the Cochrane Risk of Bias tool. So firstly, our keywords looked at 3 different aspects through a broad approach. These were mentorship or preceptorship, the field of study, which involved nursing, medicine, and health, and the type of trial, which was RCTs, or randomized controlled trials. These words were searched within the 4 databases. Upon receiving the search results, the papers were applied against an inclusion and exclusion criteria to determine suitability. Firstly, our target population was newly graduated healthcare professionals, as well as undergraduate healthcare professional students. We did not include community health care workers due to their broad role of functions, which impact both healthcare and social services, as well as their varying roles in different regions. Next, the interventional method was to solely use mentorship and compare this to a control group. Our study looked at RCTs, which were published from 2005 to 2019, that used a clinical competency scale to measure the outcomes. We considered randomized controlled trials and in-person mentorship techniques, as opposed to robot-style mentorship methods. So there were some duplications of articles amongst the databases. So this is just a brief overview of any duplication of studies that were found amongst the databases. We ensured that each suitable article was only counted for once. In the end, the total eligible articles for quality appraisal was 7. So each article that we used underwent a quality appraisal to ensure that the RCT was robust. Our quality appraisal process involved the usage of an EBL, critical appraisal checklist, and the Cochrane Risk of Bias tool. Through the usage of the EBL critical appraisal checklist, the population of the study, the data collection processes, methodology, and the results were all considered. Each section had the validity calculated to ensure the article could be considered. By using the Cochrane Risk of Bias tool, we were able to consider several factors which may have caused bias to occur within each individual randomized control trial. Upon applying both of these tools to our 7 papers, we excluded one due to lack of information available to complete the quality appraisal process. So this Prisma flowchart demonstrates the process of getting to our final articles, which we considered in our study. Initially, we identified 502 sources from our keywords, and we identified 2 gray literature sources. Upon removal of duplicates and further screening, we were left with 20 articles which were further screened. 13 were excluded as they did not meet our criteria, and we were left with 7 full-text articles. 1 was excluded due to lack of information available for a complete quality appraisal, and 6 were included in the study. So each individual study used a different competency scale to measure mentorship. This was measured against a baseline score taken before the mentorship intervention began. Each study demonstrated the interventional group to have increased clinical competency scores in comparison to the control group. The studies targeted a variety of healthcare professionals, including medical students and nursing students. And here we see the 3 other studies which targeted mid-level providers and newly graduated nurses. Of note is that one study noticed no significant change with the mentorship intervention. So visually, it is seen that providing mentorship to students and healthcare professionals who are newer in the field can help to improve their clinical competency skills more rapidly. Finally, it is important to note that there are many challenges at present towards developing strong mentorship programs. For one, in developing regions, there may be a lack of skilled healthcare professionals available to use as mentors. There may be personality differences between mentors and mentees, which may cause misunderstandings. Next, funding may also be a concern. Taking away mentors from their designated tasks for the purpose of training mentees may not be viable for some healthcare infrastructures. Despite these challenges, mentorship remains a valuable training technique. It enables the mentee to receive guidance from a more experienced individual and provides an expert connection to their line of work. In terms of clinical competencies, mentees with a mentor were found to have an increased level of clinical competency skills against their peers in the control group. More so, mentorship has been found to reduce stress and burnout rates, as well as lower job turnover rates in nursing. It is a valuable tool when used correctly. So here are the references. So this concludes my presentation. If there are any questions, please feel free to reach me at either of these email addresses. Thank you very much.